Hello. So I decided to talk about adult obesity in America. I just watched a wonderful documentary on HBO Max called Weight of the Nation, which made me want to dive more into obesity. Um, so here we go. So what is obesity? Weight that is higher than what is considered as a healthy weight for a given height is described as overweight or obese. Body mass index, or BMI, is used as a screening tool for overweight or obesity. Adult body mass index. Body mass index is a person's weight in kilograms divided by the square of height in meters. A high BMI can be an indicator of a high body fatness. Obesity is frequently subdivided into categories. So there's class 1 of 30 to 35, of 35 to 40, and then there's class 3 of BMI of 40 or higher. Class 3 obesity is sometimes categorized as extreme or severe obesity. Why it matters. Almost 1 in 5 children and more than 1 in 3 adults struggle with obesity. Nearly 1 in 4 young adults are too heavy to serve in our military. So this is a chart that I said, but only 29% of US adults have a healthy body weight. So 34% was obese, 35% overweight, only 2% underweight, and 29% healthy. Children with obesity are more likely to have obesity as adults. Obesity costs the United States healthcare system $147 billion a year. Adults with obesity have higher risk for developing heart disease, type 2 diabetes, and some types of cancer. Adult obesity causes and consequences. Obesity is a complex health issue resulting from a combination of causes and individual factors such as behavior and genetics. Behaviors can include physical activity, inactivity, dietary patterns, medication use, and other exposures. Additional contributing factors include the food and physical activity environment, education and skills, and food marketing and promotion. Obesity is serious because it is associated with poorer mental health outcomes and reduced quality of life. Obesity is also associated with leading cause of death in the United States and worldwide, including diabetes, heart disease, stroke, and some types of cancer. So behavior. Healthy behaviors include regular physical activity and healthy eating, balancing the number of calories consumed from foods and beverages. With the number of calories the body uses for activity plays a role in preventing excess weight gain. The Physical Activity Guidelines for Americans ICON recommends adults do at least 150 minutes of moderate intensity activity, or 75 minutes of vigorous intense activity, or a combination of both, along with 2 days of strength training per week. A healthy diet pattern follows the dietary guidelines for Americans ICON, which emphasize eating whole grains, fruits, vegetables, lean protein, low fat and fat-free dairy products, and drinking water. A pattern for healthy eating and regular physical activity is also important for long-term health benefits and prevention of chronic diseases such as type 2 diabetes and heart disease. So community environment also plays a role. People and families may make decisions based on their environment or community. For example, a person may not walk or bike to the store or to work because of a lack of sidewalks or safe bike trails. Community, home, childcare, school, healthcare, and workplace settings can all influence daily behaviors. Therefore, it is important to create environments that make it easier to engage in physical activity and eat healthy foods. Genetics. Do genes have a role in obesity? Genetic changes in human populations occur too slowly to be responsible for the obesity epidemic. Nevertheless, how people respond to an environment that promotes physical inactivity and intake of high-calorie foods suggests that genes do play a role in developing obesity. How could genes influence obesity? Genes give the body instructions for responding to changes in its environment. Variants in several genes may contribute to obesity by increasing hunger and food intake. Rarely a clear pattern of inherited obesity within a family is caused by a specific variant of a single gene. Most obesity, however, probably results from complex interactions among multiple genes and environmental factors that remain poorly understood. What about family history? Healthcare practitioners routinely collect family health history to help identify people at high risk of obesity-related diseases, such as diabetes, cardiovascular disease, and some forms of cancer. Family health history reflects the effects of shared genetics and environment among close relatives. Families cannot change their genes, but they can encourage healthy habits and physical activity. Those changes can improve the health of family members and improve the health history of the next generation. So other factors include disease and drugs. Some illnesses may lead to obesity or weight gain. These may include Cushing's disease and polycystic ovarian syndrome. Drugs such as steroids and some antidepressants may cause weight gain. Research continues on the role of the other factors in energy balance and weight gain, such as chemical exposure and the role of the microbiome. A healthcare provider can help you learn more about your health habits and history to identify whether behaviors, illnesses, medications, and/or psychological factors are contributing to weight gain or making weight loss hard. The consequences of obesity. Health consequences. People who have obesity compared to those with a healthy weight are at an increased risk for many serious health conditions, including the following. All causes of death, so mortality, high blood pressure, high LDL cholesterol, low HDL cholesterol, or high levels of triglycerides, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, which is a breakdown of cartilage and bone within a joint, sleep apnea and breathing problems, many types of cancer. There was an icon there, that's why it says external icon next to that. Low quality of life, mental illness such as clinical depression, anxiety, and other mental disorders, and body pain and difficulty with physical functioning. So now we talk about the economic and societal consequences. Obesity and its associated health problems have a significant economic impact on the U.S. healthcare system. 11, including direct and indirect costs. Direct medical costs may include preventive, diagnostic, and treatment services. Indirect costs related to sickness and death and include lost productivity. Productivity measures include employees being absent from work for obesity-related health reasons, decreased productivity while at work, and premature death and disability. National estimated cost of obesity. Obesity-related medical care costs in the United States in 2008 dollars were an estimate of $147 billion. Annual nationwide productivity costs of obesity-related absenteeism range from $3.38 billion and $6.38 billion. That's about 132 per individual with obesity. In addition, obesity has implications for armed force recruitment. In 2007-2008, 5.7 million men and 16.5 million women who were eligible for military service exceeded the Army's enlistment standards for weight and body fat. The assessment was performed of the percentage of the U.S. military age population that exceeds the U.S. Army's current active duty enlistment standards for weight and height and body percentage fat, using data from the National Health and Nutrition Estimation Surveys. So this is the last slide I'm going to show. I have more on obesity, the relationship between obesity and different things. I think having the knowledge will help me. So thanks for watching.